Today, my topic of discussion is precautions after bone marrow transplant. First of all, I need to explain what is bone marrow transplant. We have stem cells in the bone marrow, and the stem cells are the cells from which all the normal blood cells are produced. So, in different blood disorders, like inherited blood disorders, thalassemia, or sickle cell anemia, or some other benign blood disorders like aplastic anemia, or some malignant blood disorders like leukemia, myelodysplastic syndrome, our bone marrow is affected. And from a healthy persons, the stem cells are collected and those stem cells are infused to patients after giving conditioning regimen. The conditioning regimen is an intensive chemotherapy and total body irradiation by which the defective bone marrow is destroyed, and then the normal healthy stem cells from the healthy donor is infused. Those normal stem cells then goes to the patient's bone marrow and starts producing normal healthy blood cells. So that is basically the bone marrow transplant. But the thing is, a lot of complications are associated with bone marrow transplant. We know that it is a miraculous mode of therapy because by doing bone marrow transplants, we can cure nearly 80% of hematological malignancies. We can cure up to 90% of thalassemia and aplastic anemia. But the problem associated with bone marrow transplant is like that it causes immunosuppression. So after transplant, there is number one, increased chances of infection. Number two, the donor cells can react with the patient's body, which is called graft versus host disease or GVHD. And that's why some precaution needs to be taken. Number one is the patient needs to be in a sterile condition, in a sterile ambience. Raw food is particularly no, completely no. Patient should not travel to the in a place where there is a lot of people, and so they should avoid the small cinema halls like that. They should wear the N95 mask at least for 6 months because the mature immune system takes 6 months to 1 year time for development after bone marrow transplant. And the thing is, they needs to have a close watch about GVHD. Usually GVHD affects the skin. There can be skin lesions, and the GVHD also can affect the gut. So if the patient is having a recurrent diarrhea, then they immediately should contact the transplant physicians. Or there can be liver GVHD or liver dysfunction. So if there is any concern about that, so they immediately should contact the hematologist on the bone marrow transplant physician. Usually there is a follow-up clinic after bone marrow transplant. So meticulously the transplant patient should follow up in the follow-up bone marrow transplant clinic, where the BMT physicians can identify the abnormalities and can take the necessary precautions. And after usually 1 year of allogenic transplant, the vaccination should be given to the transplant patient. So the patient should be very meticulous about the proper vaccination after 1 year time, because if when we do the bone marrow transplant, the effect of previous vaccination is completely lost. So a new vaccination needs to be given after at least 1 year of transplant. And another chance is always a relapse. That is, for whatever hematological malignancy we do bone marrow transplant, there is a minimal chance of disease relapse. So if it is there, then the transplant physicians can identify and can do the necessary test and interventions. One thing is necessary, that is called chimerism study. Chimerism means what percentage of healthy donor cells are there in the patient's body. We preferably want a full chimerism, that is 100% chimerism. But if the chimerism is around up to 95%, then it's okay. But if the chimerism is coming down, that means if the donor cell percentage is coming down, then there is a chance of relapse, and then the necessary actions needs to be taken by the transplant physician. So the thing is, the job is not done with the transplant. The patient needs to be followed up closely in the BMT clinic, and whenever there is a problem, they should immediately contact to the bone marrow transplant physician, by which we can have a normal, healthy life after bone marrow transplant. Thank you.